Hello, I am Dr. Sandhya Gupta. I am a breast oncosurgeon and I am here to guide you as to which mammography to book for yourself, a 2D mammography or a 3D mammography. So let's begin. We all breast surgeons, we keep advising you to go for a screening mammography. Now, when you are about to book a mammographic exam, you are confused कि 2D mammography कराएं, 3D mammography कराएं, contrast enhanced mammography कराएं या MRI कराएं. So what is the right mammography to go for you for screening purposes? So let me give you a little context so you can choose better. So 2D mammograms are traditional mammograms where basically two images of the breasts are taken, one from the top and one from the side. Because only two images are taken, the amount of radiation risk is lower. That is around 0.4 to 0.5 millisievert. Millisievert is a basically measure, how you measure the radiation. So that is the amount, 0.4 to 0.5 millisievert of radiation, which is well within the FDA risks. And the cost is also lower, around 1500 to 3500. You can easily get a 2D mammography done in Delhi NCR. And now if you go for a 3D mammography, it's a newer modality. It's also called breast tomosynthesis because आपको जब आप scroll कर रहे होंगे through breast test, आपको breast tomosynthesis भी दिख सकता है. So you will be able to understand कि 3D mammography की बात हो रही है. So 3D mammography is a step ahead of 2D mammography. So instead of just taking images from the top and the side, it basically takes 15 images in an arc. The arc forms from top to the side. So basically it takes better images, it gives you more comprehensive results, catches cancers early, and basically the rates of false positive also comes down. False positive is basically when the mammography is telling there's something there but it's not actually there. So these risks also come down. But because it's a better modality and it takes more images, so that's why the risk of radiation also increases from 0.5 to 1 millisievert. But this is also well within the FDA risk range. But the cost obviously goes up. Now a 3D mammography can cost you somewhere around 4,000 to 7,000 depending on the diagnostic center you've visited in Delhi NCR. So which one should you go for? So basically if you have dense breasts, so now if you have dense breasts or not would also be revealed in a mammography only. So if you're going for a mammography for the first time, I would suggest you go for a 3D mammography because that would give you a very comprehensive idea regarding your breast density. If your breasts are found to be dense, then 3D mammography was a bright choice for you. And in the future as well, for screenings, you can continue to get 3D mammograms done because for dense breasts, 3D mammogram is far superior than a 2D mammogram. But if in this first exam, your breasts turn out to be not dense at all, then for the next mammographic exams, you can easily go for 2D mammographies because they would also reveal something similar only as compared to 3D mammography, and they are cheaper and they have less radiation cost involved. So basically it's all about a game of how dense your breasts are. So your first examination where you're not aware if your breasts are dense or not, you should go for a 3D mammography. And if the 3D mammography reveals your breasts are dense, you continue going for 3D mammograms because those would be a better exam for you. And if at any point of time in future, your breasts start turning less dense, then you can easily switch to 2D mammograms. But if the initial mammogram shows that your breasts are not dense at all, then from the next mammography onwards, you can easily go for 2D mammographies. Now, contrast enhanced mammographies and MRIs are not to be booked by your own self. These should be recommended by your breast surgeon because there are some fixed, very specific criteria for these tests. And for that, I would suggest that you take guidance from a proper expert. So this was my advice as to which mammography you should go for. If you liked the video, kindly subscribe to our channel for more such health updates. Thank you.